So I have already discussed that how we can increase serotonin level in our body through natural ways. But definitely there are also some medications that are used to increase serotonin levels in those who have um, a very low number of a very low amount of serotonin in their bodies. So antidepressant drugs, classes, and medication examples that can increase serotonin levels include selective serotonin reuptake inhibitors (SSRIs). This class includes fluoxetine, Prozac, Celexa, and Zoloft medicines that can increase the serotonin levels in the body. I have mentioned the link over here, and you can also visit the site and get more information about these medicines, their manufacturing, and other medicines that can also be an alternate to these medicines in order to increase serotonin level in the human body. So, how does these medicines play their role, or what is their mechanism of action in the human body to, in order to increase serotonin level? So, these all drugs that belong to class of compounds SSRIs. These drugs are used to treat depression, anxiety, and other mood disorders by increasing the level of neurotransmitter serotonin in the brain. After the signal is transferred, the serotonin is taken back up into the first nerve cell in a process called reuptake. This is where the SSRIs comes in and work by inhibiting the reuptake of serotonin by the first nerve cell. The exact mechanism by which SSRI inhibits serotonin reuptake is not fully understood yet, but it is believed that involves the binding of the drug to a specific site on the serotonin transport protein, which is responsible for transporting serotonin back in the nerve cell by binding to the site. The drug prevents serotonin from being taken back up into the nerve cell and allow it to remain in the synapse for longer. And yes, it is important to be noted that every medication which have some hypothesis also have some negative or side effects on the human body as well. Might be possible that they can treat a disease for which that specific medicine is being used, but it can also cause side effects to some other organs or some other whatever. So it is important to note that SSRIs are effective for many people, but they can also have side effects and may not be suitable for everyone. Anyone considering taking an SRIs should concern with the healthcare professional and provide to determine if it is the right treatment option for them or not. I have also mentioned the sources. Uh, I have mentioned a book over here which can give you a more in-depth detail about these medicines and the mechanism of action in the body. I have also mentioned the link over here. It's National Institute of Medical Mental Health, and it can provide you with the same information. So, what is the role of serotonin in cognitive function? Cognition means high level of serotonin having shown to boost cognitive abilities. Cognitive means ability to think, including memory and learning speed. Autonomic nervous system functions. Studies have shown that serotonin enhances our autonomic nervous system that functions for flight or fight response. The next neurotransmitter we're going to discuss is dopamine. Dopamine is a chemical release in the brain that makes you feel good. Having the right amount of dopamine is important both for your body and for the brain. Dopamine helps nerve cells to send messages to each other. It is a type of monoamine neurotransmitter, and it's made in your brain and act as a chemical messenger, communicating messages between yourself in your brain and the rest of your body. What is the role of dopamine in the body? Dopamine plays some vital roles as a neurotransmitter. Dopamine is involved in movement, memory, pleasurable reward and motivation, behavior and cognition, and attention. Also, it plays a role in sleep and arousal, learning, and lactation. As a hormone, dopamine is released in our bloodstream, plays a small role in fight or flight syndrome. The fight or flight response refers to our body's response to a perceived or real stressful situation that is needing to escape danger. Dopamine also causes blood vessels to relax. At low doses, it acts as a vasodilator or constrict. At high doses, it acts as a vasoconstrictor. It increases sodium and urine removal from our body, reduces insulin production in pancreas, and reduces lymphocyte activity in our immune system. Now, how does dopamine makes someone feel happy? Dopamine is like serotonin. Dopamine, also known as a feel-good hormone, it gives us a sense of pleasure. It also gives us the motivation to do something when you're feeling pleasure. Dopamine is a part of our reward system. The system is designed from an evolutionary standpoint to reward you when you're doing the things you need to do to survive. When you have a normal amount of dopamine in your body, you will feel confident, you will be more um, focused towards your ambitions, you will be motivated, and you will be happy with the things you're doing. As humans, our brain are hardwired to seek out behavior that releases dopamine in our reward system. When you are doing something pleasurable, your brain releases a large amount of dopamine, you feel good, and you seek more of that feeling. That is why junk food, sugar are so addictive. They trigger the release of large amount of dopamine in our brain, which give us the feeling that you are on top of the world and you want to repeat that experience. How might I feel if I have right amount of dopamine?